Hi guys, Ollie from On Your Game here. I'm going to be talking to you about cramps today. So I'm going to leave it a minute, see if anyone wants to join in, and then I'm going to get started. I hope you're all well today. I've had nothing to this. Cool, okay, so what I'm going to be explaining to you all is what we know affectionately as a cramp. I'm going to be talking to you about why they occur, what they are, and pretty much how to avoid them. I know there's been a few recommendations which everyone knows. I'm going to explain if they're myths or not, because there's a lot of misconceptions when it comes to cramps. I know a few of my patients have been trying different methods recently. So I'm going to try and get them all sorted today. And then there's been, if you are on TikTok much, James Smith did a video about Prime versus Gatorade or Lucozade, and sort of talking about why Prime isn't actually that essential towards recovery and hydration, which I will cover. But I thought, first of all, let's just go into what a cramp is. So a muscle cramp is an uncontrollable and painful spasm of either it's a muscle group, so it could be all three quad muscles, for instance. It could be just one muscle. It could also just be a spindle of muscle, so one of the pieces of a muscle. We really commonly see them in the calf. We see them in the hamstring quite a lot. I know footballers get them quite a lot in their hamstrings. It was actually found that 80% of cramps based from exercise occur in the calf, actually, the calf region, and it's also the foot as well. A cramp can last for a various amount of time. We can get them for minutes, we can get them for seconds. You know, most commonly they'll last up to 30 seconds, and they usually resolve by itself. And what the fascinating thing is, like a lot of research, is that we don't actually have a definitive answer for cramps. We don't know exactly why we cramp. There's a few theories. There's two main ones, which I'm going to talk to you about. But mainly it can be stuff due to poor physical condition, our mineral and electrolyte balance, and tight or inflexible muscles as well. As we know, cramps result in a continuous and involuntary, painful, localized contraction, as I said, of a muscle or an entire muscle group. Cramps usually are harmless, but sometimes they can be symptomatic of an underlying medical disorder, such as one that we know as atherosclerosis, which is the narrowing of arteries, which then leads to poor oxygen supply. And as I explained in my muscle knot video, so if you haven't seen that, definitely scroll down and have a look at that. We know that poor oxygen leads to poor muscular control. We're not able to generate the contractions, or vice versa, the contractions actually stay and we're not able to release the muscle contraction. And yeah, so that's all in my muscle knot video, so definitely go back and watch that. Regular cramping that lasts longer than a few minutes, we should always be investigating. But what I'm going to be covering today is something that we know as exercise associated muscle cramps. These are our really common muscle cramps, and these are the ones that we get from playing sport, we get from the gym. There's lots of different types of cramp, but the one I'm going to be talking about is the ECMC, or exercise associated muscle cramp. So if you hear me referring to anything as ECMC, that's going to be just exercise associated muscle cramp, basically when cramping occurs due to exercise. Because this is the one that I see the most. This is the one that we usually do our interventions in, whether I'm in a sporting environment or in a clinical environment. This is the one that's most common. So when I was doing my research, I found some really interesting statistics. Basically, there's no relationship between sex and cramps. So if you're a man or a woman, it doesn't matter. Cramping occurs usually around the same rate. And as I explained earlier, about 80% of cramping occurs in the calf region or in the foot region. And that's the one that's most associated with our EAMCs, okay? There's also something called a nocturnal leg cramp. So if you're getting cramps when you're sleeping, this is what we call a nocturnal leg cramp. And it affects about 6% of the American population. And it usually is a condition that seems related to heart problems or depression. due to the chemical imbalances. I didn't do too much, I'm not going to talk to you guys too much about that today, but if you do want to come into clinic, if that's something that's related to you, definitely come in and speak to us. And the last little piece of information is another American study found that 74% of cramps occur in athletes in high environmental heat conditions. So as we know, heat plays a massive part into cramping due to lots of reasons, mainly to do with the loss of liquid, which I'm going to get onto. Now, there's a common misconception. The pathophysiology of muscle cramps is not always clear, and it depends on each patient, and it depends on their condition. To give an example, in a healthy sporting subject, there's no direct relationship between the depletion of fluids and the alteration of electrolyte balance as a definitive cause of cramps. So we usually see, what I tend to hear the most is, I need to replenish my electrolytes, I need to replenish my sodium intake because that's been depleted. But there's actually not been there's not a direct relationship between the depletion of fluids and the alteration of electrolyte balance. So even though electrolytes obviously play a part in cramping, it's not a direct link, let's say. So let me talk a bit more about these exercise-associated muscle cramps. This is an event that frequently occurs during or after physical activity. And there's two main hypotheses why these occur. The first is related to the concept of dehydration and electrolyte imbalance, while the second is a newer theory which relates to something called the transient peripheral neurological disorder, which I will explain in a bit. But the main findings indicate that peripheral fatigue, so fatigue in our legs or in our arms, of neurological origin as a cause for the appearance of cramps. Sorry, let me say that again. The main findings indicate that peripheral fatigue of neurological origin are of neurological origin as they're the main cause for cramps. Continuous muscle contractions increase the afferents from the neuromuscular spindles, with a parallel inhibitory effect on Golgi tendon organs. Stretching before physical activity actually does not prevent the appearance of a probable cramp, which is quite fascinating actually. So it's found that even though there were two control groups, one that stretched beforehand and one that didn't stretch beforehand, and it was found that that did not appear to change the possibility of a cramp from occurring. So what are the theories as to why cramp occurs? So as I said, the first one is this thing that we call dehydration and electrolyte imbalance theory. It's the one that's most commonly used. It's been around for, hundreds, about 100 years probably, since like the first data came out. It's primarily based on clinical observations, and it proposes that EAMCs occur when sweating causes a contraction of the interstitial fluid space, increasing excitatory neurochemicals and mechanical pressure on motor nerve terminals. Very fancy for saying the liquids you lose through sweating places more pressure on the muscles, making it harder for you to switch between a contracted and non-contracted state. So it's basically saying that when we sweat, we lose obviously sodium, potassium, all of these things, which then make it harder for the muscle to stop a contraction. And this is actually all explained in my Muscle Knot video. It goes into the 3 different types of our exercise. Obviously, when we use oxygen and when we don't use oxygen. Obviously, we see that athletes who use a lot of oxygen tend to cramp up easier. We see it after long races. We see it after, long football games, when they have to play for 100 minutes, let's say. That's when we're most commonly going to see cramping occur, because you lose more fluid throughout the longer duration of exercise, okay? So even though they can occur with shorter, so we see it with sprinters, obviously, it's more common within runners. We see it more commonly within high endurance athletes, because they're losing more fluids and they're losing more of that sodium and the potassium, which is then making it harder for the muscle to stop a contraction from occurring. Many observations over the last 100 years seemingly support this theory. The early researchers speculated that EAMCs were due to 3 main factors: sweat-induced fluids and electrolyte losses, as I've just explained. Hard work by people who are unacclimated to heat. So if you have just decided to run a race in 40-degree heat, 35-degree heat, much more likely that you're going to see a cramp occur. also ties into us losing fluid as well, and also exposure to high temperatures. So when we're in heat, we're more likely to incur a cramp. So they're all relating to pretty much loss of fluid, but the heat obviously doesn't help internally, makes it much harder for the muscles to stop a contracted state. However, fluid and electrolyte balance measures are often unreported, and often when we see these three factors occurring, we're also seeing other symptoms such as gastrointestinal illness, which we see as vomiting, diarrhea, stomach pain, alongside the cramps as well. So, for instance, my mate just ran a marathon and he's never ran one before, and because it was such an intense, long-endured race, as is a marathon, he basically lost a lot of fluid without replenishing it, and that was just a sure way to get a cramp. So he got stomach cramps, he got leg cramps, and it's all about this replenishing the fluid that we lose and successfully replenishing it in the right way, which is what I was explaining earlier about this James Smith video where he compared Prime to Lucozade, and the differences that they have between them and which one is more of an effective replenisher of these fluids. And just to finish off there, scientists have also found when diet, hydration status, environmental conditions and exercise intensity were all controlled, no differences in sweat characteristics were identified among the athletes with various cramp conditions. So if they're susceptible to cramps, if all of the things I just mentioned were in a controlled way, they wouldn't then have a difference in whether you're susceptible to cramping or not. It's mainly down to these factors that I previously stated. So let me talk a bit more about Prime versus Lucozade, because it's something I'm interested in, even though I don't really like Prime. And I was thinking, what's the difference? Basically, what we see is Prime has high levels of sugar and low levels of sodium. And for something like Lucozade, it's the opposite. So we'll see high levels of sodium, low levels of sugar. Have I got that right? No, other way around, sorry. So Prime has high levels of sugar, low levels of... Other way around, sorry. Prime has low levels of sugar, high levels of sodium, and vice versa for Lucozade. What we see is why glucose is so essential is because we see rapid hydration. So we see hydration happen quicker through glucose than we would with just sodium. It takes a while, up to like 15-20 minutes for sodium to take effect. Whereas with our glucose intake, we'll see rapid hydration. So we'll see that within the first 5 minutes, which is the main differences between those two. So when you see prime hydration saying we've got really low sugar, it's not actually a good thing that it's got low sugar. It's going to make our rapid hydration a lot slower, and it won't be as effective in the short term at getting our levels of sodium, our levels of potassium back up to where they should be, as opposed to if you were to drink a Lucozade. So a little snippet for you there. Now, the second theory is something called altered neuromuscular control theory. The altered neuromuscular control theory was proposed originally in 1997, and it was updated in 2009, and it's offered as a new explanation for why EAMCs occur. This theory suggests that cramps occur when fatigue and other risk factors contribute to final common pathophysiological pathway to produce an imbalance between excitatory and inhibitory stimuli at the A motor nerve. The theory arose out of observations that fatigue altered muscle spindles and Golgi tendon organ firing rates were different in an animal model. Very confusing. That was basically just taken from a text. What it means is the theory suggests that EAMCs result from altered reflex control mechanisms in response to neuromuscular fatigue, or the more fatigued the muscle becomes, the harder it is to stop a contraction. So the first theory suggested that it was due to the fluids that we lose and the heat. This one is suggesting it's more to do with the how fatigued a muscle can become over time, which makes it harder to then stop a contraction. What do I think? I think they're both very good theories, and I think there's an equal part to play in both of these theories as to why cramps occur. So for me, what I take away from this is the more fatigued the muscle gets, the harder it becomes for the contractions to stop. And also, due to loss of fluids and due to the heat, we also then, it becomes much harder for muscle contractions to stop as well. So they're the two main theories, and they're what I would take as Bible for why cramps occur. Now, what are the symptoms of cramping? Our main symptoms are going to be a sudden sensation of uncontrollable and painful spasms of the muscle, and also we're going to see some muscle twitching as well. The muscle tissue relies in part in a range of minerals, electrolytes and other chemicals in order for the muscle to contract and relax. Some of these important substances, as I previously mentioned, calcium, magnesium, potassium and sodium. So if we have an inadequate diet, which could be factors such as dehydration, not eating the right foods, not having the right balance of minerals within our body, and also electrolytes, makes us more susceptible to cramping. So that is, you could look at it as one of the ways that we can stop that. So making sure that we have enough of these chemicals that are really important for the contraction and relaxation of the relaxing of the muscle to then stop future cramping. So yeah, let's talk more about the risk factors for muscle cramping. As I said, the exact cause isn't known, but some of the other reasons that cramping can occur is also due to tight and inflexible muscles. So if we already have tight calf muscles, the action of a long endurance race or exercises is going to personify that and make the issue worse. If we're in poor physical condition, that's definitely going to make it worse, not just because of the diet, but also because we're actually putting a lot more weight and a lot more effort into what we're doing, especially within a long endurance race. So if we're overweight, there's going to be more pressure put through the muscles, leading to more energy exerted, less fluid within the muscle, and it's going to be that cycle again. So I'll just rattle some more off here. Overexertion, so if we're pushing ourselves too hard, cold muscles, so if we're not properly warmed up, muscle injury can also be a factor to play within cramping, and also reduced muscle blood supply, which is what I previously mentioned at the top of the video. So what are our best treatments for cramping? The best treatment that we have for cramping is always going to be stretching. That is the fastest, it's the safest, and it's the most effective treatment. You can either do it self-administered or have a clinician stretch you as well. Basically, static stretches increases tendon tension, and elongated muscles produce the greatest Golgi tendon organ inhibition, which may help to restore the balance between excitatory and inhibitory signaling, and explain the reduction of muscle activity observed when cramping, when muscles are stretched. It's the best by far. Stretching, number one. What else can we do? We can also use ice packs. If it was to be a severe cramp, an ice pack can be applied for a few minutes, which just helps the muscle to relax. As I've previously mentioned, what beverage type we're having when we're on long runs, if we're doing a long-term or a longer exercise period, definitely be having our Lucozades, our Gatorades, as opposed to our primes. There's also something called transient receptor potential receptor agonists, which we can see as like pickles, for instance. The transient receptor potential, or TRP receptors, detect temperature sensations in the mouth and esophagus, which ingredients such as vinegar, cinnamon, capsaicin, ginger activate these receptors, and in theory may affect neural function if potent enough. So they also help. Pickles, 100%, stuff like that. Vinegar, cinnamon, capsaicin, all very good. Will also help with cramping. What was that study I had? So there's been a study with two of the more popular TRP agonists, which are pickle juice and mustard. And these are both due to their high concentrations of vinegar, salt, or both. And in one single blind test, ingestion of small volumes of less than 100 millilitres of pickle juice relieved cramps 45% faster within 68.6 seconds than no fluids, and 37% faster than water. So yeah, so pickles are very effective at relieving cramps. I know when I was at uni, we did a test with beetroot juice as well, and that was found to be effective at relieving cramps. And then the last one, which I hear a lot of people ask me if it's any good, is bananas, because bananas have potassium. Now, potassium is generally not considered as an electrolyte of interest for EAMCs, yet bananas are sometimes used during treatment due to their high potassium and glucose content. However, no evidence exists for their efficiency. Some data suggest they are unlikely to help by increasing blood potassium. Dehydrated participants who ingested 1 or 2 servings of bananas post-exercise did not experience increases in plasma potassium concentrations or plasma volume until 60 minutes after consumption. Interestingly, plasma glucose increased significantly in the 2 servings trial, but this effect occurred 15 minutes post-indigestion. So bananas, no. Pickles, yes. So yeah, that's been my video on cramping. If you have any questions, after you watch this video, please pop them in the comments. I hope you've enjoyed it, and I will see you at the next one, guys. Thank you so much.